We all evolve as a professional and we learn so many things, our perspectives change. But everything cannot be learned on our own, from our own experiences, because there is so much to learn. So today we are going to speak to someone who has really seen it all and really is keen to share his experience with us. Let us see what Dr. TL and Praveen sir has to say. So I have with me one of the doyens of fetal medicine practice in India, Dr. TL and Praveen sir. Welcome, sir.
Hi, Chandrasekhar.
So it is such a privilege to talk to you from a person with such a vast experience, and the kind of knowledge that you've shared over the years has really enriched so many of us, radiologists. So there are certain questions that I want to ask you, and I think you are the best person to do that, because there are very few people who have come from, clinical radiology practice to fetal medicine, and I think you are one of them.
Yes.
Sir, now when I practice radiology, not just me, but many radiologists like me have this dilemma. How much should I educate myself? There are two extremes of it, where I may not educate myself enough and not keep up with the advances.
Yeah.
And there is the other extreme, where I may over-educate myself and I may not be able to implement that in practice.
Mm-hmm.
And why am I educating myself so much is because of the increasing competition nowadays, because everybody is upgrading and I need to keep up.
Yeah.
At the same time, I have to be very practical with this thing, that whether I am able to actually implement that knowledge in my practice. So whether it is improving my practice for the better. So what are your thoughts about it?
See, basically as a radiologist, because I have started as a radiologist and then progressed or migrated into fetal medicine. My personal experience is that there are certain niche areas in radiology. One of them is fetal imaging. In fetal imaging, it's really challenging. In the sense, if you take your routine clinical radiology and the fetal medicine, there is a vast difference between the two. And I think educating yourself is never over. I mean, you need to educate, you need to upgrade yourself, in the sense, today the competition is so much, and then the patients are also well educated, they are well versed with things which are happening, and you need to provide them that sort of a service. Basically, when you are providing that sort of service, unless you are educated, you will not be able to provide them, and then able to give them the best service that can be provided. And for that, definitely your education is important, and upgrading yourself into fetal medicine is extremely important. Now, as a radiologist, when you are being trained, you are basically very limited exposure to fetal imaging. Now we need to, that is actually the bread and butter of our day-to-day practice. If you take it into say consideration, that is the major contributor to our day-to-day practice. In that situation, positively, you need to be upgrading yourself as far as the fetal imaging is concerned. Fetal imaging is not just imaging. Fetal imaging consists of evaluating the clinical aspect of it, evaluating the genetics, evaluating various other imaging modalities also, which are extremely important as far as the fetus is concerned. And most important thing, as all of us, we are parents, we know that we would like to have the best of everything. So, unless you are well equipped with it, I don't think you will be able to cater that.
Right, I agree, sir. The only thing is that when I interact with so many radiologists today, they ask me that, fine, I really want to do a structured training program, and at ScholarMD we are providing one extremely good structured training program. Their question is, at the end of it, how is it really going to change me from a radiologist to somebody who is practicing fetal medicine?
Mm-hmm.
What change is expected in me, and will I be able to actually observe that change in me? What do you think about that, sir?
I'll ask a straight question to you as a radiologist. What was the amount of respect you derived by just doing a routine clinical radiology examination? And what is it that you are going to expect if when you are doing a structured evaluation of the fetus, the amount of respect which you gain, either from the patient or from the clinician who is being referring to you, is enormously changed.
Right.
I mean, I think that
Right.
sort of a satisfaction you will never get it.
Correct.
Maybe you will be doing numbers. I don't say no to it, but then that satisfaction and the respect which you gain out of this sort of experience which is entirely different.
Right. Very true, sir. The one thing again that comes to my mind is that as my knowledge of fetal medicine has grown, the time I'm giving to every patient has also increased. Here again, there is a friction.
I know. I can
The
understand.
more time I give to a patient, the less time I'm able to give to other patients.
Naturally.
At the same time, I have to keep my practice viable. And this is a problem not just limited to me, but I think you must have also experienced
Naturally. Correct.
that as we increase the depth of our knowledge, the time that we need to invest in each of our scans is more and more.
More and more.
So how do you solve this problem?
See, basically, you need to understand one most important thing. See, as it is, fetal medicine is a little away from the routine radiology practice. Definitely, you need to devote more time to it. There is no doubt about it. But if you are trained in a structured way, you know how to approach a clinical problem regarding the fetus, and you know how to plan your examination. By doing that planning properly, I think the time can be really matter. I mean, maybe initially you may take more time, but then as you keep on doing things, I think things become very easy. And then you know what are all the protocols that are there, what are the protocols that you need to follow, and then those protocols, if it is followed, I think the time is not really that is going to impact on your practice.
Right. So this is very important. I feel what the point that you're making is that as you develop more and more expertise, your time to judge a particular structure as normal in a fetus goes down.
Exactly.
Your confidence of diagnosing it as normal goes up.
Yes.
And I think diagnosing something as normal is one of the most difficult things.
Yeah, absolutely.
And if you have mastered it, and if that time of diagnosing the normal has gone down significantly for you, then I think what you're saying is very true. That this problem can be solved that way.
Yes.
Now there is one more thing, sir. In corporate setups, now for example, if somebody has a private practice, he still has some leeway, where he can structure his practice, where initially if he's taking more time, he can give patient appointments, accordingly. But somebody who is employed in a corporate setup nowadays, there is a metric that they use turnaround time.
I know.
And it's really unfortunate that today we have to race against time more than anything else. But I also understand their perspective, because there is a business element to healthcare, and they also have to take care of that.
Correct.
So as you have grown your expertise in the fetal medicine over so many years, and you have also worked with corporates.
Yes.
So what has been your experience that people who have worked in corporates, or the colleagues that you have seen who have worked in corporate areas, have they been able to grow their expertise to a level where this dilemma has been resolved?
I think the desire to learn and desire to implement is very important. That makes you convince the corporate officers or the corporate people that this is an essential component. Because see, if you have this sort of a niche practice which has been developed over a period, I mean, the corporates are the ones who are going to get benefited if you are working for a corporate. So naturally, your turnover time, as you are reducing the number of, the amount of time spent in identifying a normalcy, if it is reducing, naturally the numbers are. See, as far as the corporates are concerned, they want the numbers.
Correct.
The numbers can be achieved. Only point is that initially you may have a little difficulty, but over a period of time, as your learning curve goes up, I think you will satisfy them. And the amount of satisfaction which they get by giving such a good niche expertise is going to be really appreciated by the public, and then they will get more number of referrals.
Very true, sir. You interview so many radiologists nowadays, when you have to employ for hospitals.
Correct.
What are the three things you think you see lacking in today's radiologists, particularly in the field of ultrasound practice?
Yeah.
And what would you want them to have these three things so that they succeed in life?
Yeah. This is a very important question. And then I find it very amusing when I interview some of these young radiologists. They have a desire to work, they have a desire to earn good name. But the problem is that their curriculums are not trimmed or trained, planned accordingly.
Correct.
So, if we have a structured planning, in the sense structured training, what happens is you are tuned to face this reality in your day-to-day practice.
Correct.
Now, when it comes to the reality, what as a radiologist who has migrated into fetal medicine, I would expect someone who is going to take over the task of evaluating fetuses or by ultrasound. I think they will definitely have to get trained. There is no second thought about it. Okay. And that training should be structured, that training should be protocol based so that it becomes much more viable. That is one. Another important factor is that as you see the clinical practice which is developing, the amount of counseling which we were never taught in our day-to-day practice, in our radiology curriculum, there is nothing like a communication with the patient. Quite often, most of the times that we do a scan and give the report and ask them to go back to their clinician.
Perfect, sir. In fact, if you go back 15-20 years,
yes,
the norm was that you as a radiologist are only supposed to give a report.
And not to talk.
Not to talk.
Not to talk. Yes. So, but then now present, no. That is not acceptable. And not only that, I'll ask you one simple question. As an obstetrician who has been taking care of the fetuses or pregnancies, how much are you aware about the various complications or the abnormalities that they come across in their practice? They're absolutely no, because they are not exposed to it.
Correct.
Whereas as a radiologist, you are exposed to it. Your only thing is that you are honing your skills in evaluating that or putting that into fetus. So that what happens is, unless you communicate with the patient, and the patients nowadays, they expect you to communicate.
Correct.
It's not just a monologue in the sense you just do a scan and give them off and down. No, you need to talk to them. You need to convince them. You need to explain them what is the problem.
Agreed.
And that is their right. I don't deny that. It is not something that you are doing a favor.
Correct.
It's a part of your job. So you will have to get tuned to it and you have to learn how to talk to it. That is one of the most important things that I feel the radiologists are lacking. So when a person who comes to me for an interview, the things that I expect is that how much of communicating skills he has. That is one. Second most important thing is how well is he trained so that he can take care of the patients. Third most important is how is he going to time manage it. These are the three things, because see, when I am interviewing someone for a corporate, these are the factors which I have to keep in mind.
True.
So I expect them to have that. So in order to have that, they have to be trained. There is no second thought about it.
Correct. Thank you so much, sir. Because I think this is one area of practice, time management vis-a-vis giving your best for the patient.
Yes.
Is something that we have to resolve. And that I think that resolve can come only with enough expertise, like you have said, and having the right attitude towards it.
Yes.
If you're taking it in a way that I have to do it because I'm compelled to do it, then it is not going to work.
No, it doesn't work.
Exactly. So, sir, thank you for enlightening us in this area, and I think this will be very helpful for all the young radiologists who are watching.
Thank you
so much.
Thank you very much.